livers are pretty resistant to alcohol damage. And part of that answer also depends on a few other variables, on weight, which can also have adverse effects on liver. But in early studies, it took to get cirrhosis of the liver in animal studies, it took the equivalent of like about 10 drinks a day for 10 years for cirrhosis to develop. And so in animal models of heavy drinking, it takes lots of alcohol before you see liver damage and cirrhosis. There's been a recent a deeper appreciation, but even in those circumstances, not every animal gets liver damage and cirrhosis. So there's been a much deeper appreciation over the last 10 years in the role of inflammation and even the gut microbiome plays in progression of liver disease. And so it's thought now that toxins are released, and they can be immunotoxins, are released with exposure to alcohol from the small bowel and into the liver that causes a lot of the progressive liver damage associated with alcohol. It still takes a lot of alcohol. You don't see this really ever at low alcohol consumption levels in people with normal weight, right? But in people who either drink more than like 4 to 6 drinks a day, or have obesity plus drink a lot, you can see these changes earlier. And even in these populations, again, like there's a lot of variability, suggesting there are other factors involved more than just the alcohol or the weight itself. So science is closing in on these. Stay tuned. Expect actually some very interesting possible interventions around people with alcoholic hepatitis. There are medications under development, and there's a much better understanding of the relationship between your own immune system and maybe too much immunity, right? And progression of liver disease.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.